Hello, this is Dr. Patrick Hu from Moffitt Cancer Center. I'm here with Dr. Fred Locke, who leads our CAR T programs. Dr. Locke, thanks so much for joining us.
Hi, Patrick. Thanks so much for having me.
Tell me, what is CAR T therapy?
CAR T therapy. Well, CAR stands for chimeric antigen receptor, and that's simply an artificial molecule that's put inside immune cells called T cells. We all have them. They circulate in our blood. They hang out in our lymph nodes, and they fight infection. And all those T cells recognize all kinds of different things, the flu and COVID and bad things that we don't want in our body. With CAR T cell therapy, we reprogram those T cells. We take them out of the patient's body, typically, reprogram them with that CAR, and they now have been sort of reprogrammed like a GPS. They know where to go once we infuse them back into the body. They go after the cancer. And in most cases, we use CAR T cell therapy for lymphoma and multiple myeloma and some leukemias. And it leads to remarkable response rates.
Yeah, so there have been really great responses as well as FDA approvals for some cancer types. Which are these cancer types that have FDA approved therapies now?
Yeah, we have quite a few products on the market now. We have CD19 targeted CARs that are FDA approved. We have axicabtagene ciloleucel, which is approved for large B-cell lymphoma. Mantle cell lymphoma has an approval for brexacabtagene autoleucel. We also have a product called Tisagen lechlucel, which is FDA approved for acute lymphoblastic leukemia in adolescents and young adults. And it's also FDA approved for lymphoma. And we have FDA approvals for multiple myeloma as well. So there's a number of different diseases that can be treated with CAR T cell therapy. And again, the FDA approved indications for CAR T cell therapy include diffuse large B-cell lymphoma, mantle cell lymphoma, follicular lymphoma, acute lymphoblastic leukemia, and multiple myeloma. And we expect many more to come.
And you run a dedicated floor that just does T cell therapy. Why is it important to have a dedicated floor for T cell therapy of not just doctors, but nurses and pharmacists?
First of all, these therapies require special expertise to manage the cells and both to take them out via apheresis usually, which is a procedure, and also to infuse them back into the patient. That the nursing staff and pharmacy staff have to have special expertise. We also have to be able to recognize and manage some of the unique toxicities that we get with these therapies and get patients through that first month after treatment and get patients to the other side when all those toxicities in almost every case resolve. So that's why it's important that we have that dedicated unit and that dedicated team.
So I know that your team is doing a number of exciting trials now for the next generation of therapies. One of those is with allogeneic immune cells. Can you talk about those studies?
We are testing out donor T cells or allogeneic CAR T cells. And the potential advantage to donor CAR T cells or allogeneic CAR T cells is we don't have to wait for them to be made. It's from a healthy donor. They can be made ahead of time, frozen, kept in the freezer and ready to treat in a much quicker interval. So donor CAR T cells offer that sort of off-the-shelf approach. Like everything in medicine, we've got to test it out. We've got to try it out in a well-controlled clinical trial. And we wouldn't have the CAR T cell therapies we have today if we didn't do clinical trials for our patients. So, I always encourage patients to consider clinical trials because we design those trials because we think it can work better or have more advantages to the existing treatment.
Where do you think the next steps for CAR T cells are headed? For example, solid tumors. Where does that stand, and what trials are you doing there, and how can we get more responses in the solid tumors?
So in order to successfully treat patients with solid tumors using CAR T cells, we have to be more creative. And we have clinical trials testing out CAR T cells, either open or about to open at Moffitt Cancer Center, including those for prostate cancer, pancreatic cancer, colon cancer, and more to come, lung cancer. So these are being tested out in a little more sophisticated ways. They have on switches and off switches, so they don't damage the normal tissue, but do damage the tumor. And we're very excited about the possibility.
Wonderful. Well, thanks so much, Dr. Locke, for being with us today. Dr. Fred Locke, an internationally acclaimed CAR T expert from Moffitt Cancer Center. Thanks for being here.